We recently had the National Academy of Science look at our program, and what they really said was, you know, it's a great program, but what you guys really excel at is figuring out how pesticides move off-site into the human body or the environment and how to protect. You know, the reality is that, you know, modern society relies upon pesticides. It's what gives us a vibrant, reliable food supply. It's what provides us with public health, provides us with resource management, water, all of that. So pesticides are part of what we're going to be using for the long-term future. So it becomes really important, how do we get the benefits and then reduce the negative consequences? And that's what this department has really excelled at. And not only understanding that, but then communicating that and teaching that and getting folks that are using pesticides or around pesticides the right education so that they are safe.
Well, first of all, thank you for coming, for taking your time out of your day to come and learn about what DPR is doing on educating field workers. The title of my presentation is Public Outreach on Pesticide Safety. This all started for me in 2008 when DPR did a position for an outreach worker, and I was interviewed and hired. And this is why. The law was amended in 2004 to require DPR to create a program on conducting outreach activities for worker safety for those potentially exposed to pesticides. And this included in the community who lives in the urban, rural areas, and anybody who can be exposed to pesticide, which includes household products. And the goal of the outreach, it was to reduce pesticide exposure and illness through education, and of course to report pesticide exposure as well. And this cannot be done by myself or with the CACs, the County Agricultural Commissioners. This has to be done in collaboration with community clinics, with nonprofit organizations, migrant ed programs, schools such as the Head Start program. And the outreach approach, I mean, honestly, the reason I was hired is obvious. I'm bilingual. I know I was born in Mexico, so I know the culture. But not only that, you have to have good listening skills, good communication skills as well, and follow through. I always believe and always tell other agencies to follow through with the community needs. And the main focus on pesticide safety is for farm workers and promotores de salud. I will tell you later on what promotores de salud stand for, and other underserved communities. And we offer this pesticide safety information, again, like I said, through community-based programs and services. I do presentations at the community meetings in schools, festivities, health fairs. And also I've been invited to broadcast this in Spanish and Hmong in Fresno, and indigenous languages through Radio Bilingüe or Telemundo, Univision throughout the state. So this is the definition of the promotores de salud. It's actually just community health workers. They are trusted by the community. It is familiar that the community does not trust governmental officials. But they do trust somebody who lives within their community, someone who they understand, and it's basically is the go-to person. So we at DPR, we're educating these promotores de salud, which mostly are females, and some are paid in clinics, but most of them also do volunteer work. And they achieve the results by increasing access to care, also decrease overall costs, and improve health status for the whole family. So they're there for the community. So these are just some of the events that I attended, and some of them, because you'll see the list of how many I've attended in the many years. But the Cinco de Mayo, which is most familiar to you, but the 16th of September is actually Mexicans' Independence Day, and it's not so popular like it should be. I work very closely with the County Agricultural Commissioners, the Mexican consulates, chamacos, some organizations that you probably even heard. I also attended coalition meetings, and this is also important because these coalitions exist within these counties in San Diego, Imperial, and they're very important because these are groups of organizations that meet to find ways of educating or to reaching the community. Unfortunately, most pesticide exposures occur in the home, especially with the children. So these are also some of the topics are the same as the field workers, but at the home, I emphasize on keeping pesticides in their original container because there's been a lot of incidents where they're putting Clorox or pine salt in a soda container or water container. Unfortunately, the kids gets poisoned, right? So, and also I provide them the poison control system's phone number and also remind them how important it is to read the label. So this is something that we're working very hard also to not only focus in the field workers, but also in the community in general. We developed some materials. We have some materials as well, but we developed some video and audio. Is very important. We have done several focus groups. Unfortunately, in the Mexican community, some people don't know how to read or write. So we need to educate them by just listening or watching a video. And that's part of the field worker training, right? And I also distribute the consumer fact sheets, the pesticide information series, the community guide, comic books. Comic books are really welcome because they see them as a soap operas, it's like what follows, but they're educational. And this is a good moment to share the videos that I mentioned. They're in Mixteco and Zapoteco, but right now we're going to play 2, and these are the short ones. We have 5. 3 of them are for the field workers, 2 for homes. So we're just going to share 2 30 seconds, 1 for the homes and 1 for the fields.
Señor y señora Ramírez, bienvenidos a la fiesta.
¡Ay, Dios mío! ¿Qué es esto? ¿Sabes? Ellos no estarían aquí si tú hubieras leído las instrucciones en la lata.
Yo solo rocié.
No permito.
And these are 3 comic books. The one on the left, we worked on that, but the other 2 are from the Migrant Clinician Network. The one in the middle is focused for families who live on or near the fields, especially with the kids. And the one on the right is for pregnant females who are working on the fields. We distribute poison control systems phone numbers either by the magnet or giving it to them by taking the poisonous plant poster. And the back has more information about that and then the poison control systems phone number. And also we updated the employer responsibility booklets. There's 7 of them, and 1 we did on the drift. But these are very important because even though these were meant for the employer, the employees will also like to know what is their boss's responsibility towards them. So these are well received as well. And again, on one side it's in Spanish, the other side is in English. And these also can be found on our website. So the feedback regarding the outreach program, very positive from communities reached, from service agencies. And just like anything, we need to improve. And this is their feedback. They need new topics, such as information for the hotels, for the janitors, emphasizing on graphics. Like you saw this one when you came in. This is really welcome, especially for men, because they don't want something big. But you can see there's more pictures than wording. This is all very interesting. And I'm learning. So, muchas gracias. Any questions?
Regulation Worker Health and Safety Unit. Sounds impressive. It's just me. So. And I'm going to talk about health and safety projects, education. It's kind of outreach we've done with various agencies and companies and the things we do to get information out to pesticide handlers and users and those other people who deal with pesticides. How many know what a pesticide is? Got one. Better. Yeah, well, better. Yeah. It's under FIFRA, the Federal Insecticide, Fungicide, and Rodenticide Act, This is the federal stuff. Any substance, mixture, or substances intended to prevent, destroying, repelling, or mitigating any pest. Oh, that's insects, rodents, nematodes, fungus, weeds, other forms of terrestrial, aquatic, plant, animal life, bacteria, other microorganisms, except viruses, bacteria, or microorganisms on or in living man, because that's a what? That's a drug. Not our jurisdiction. Until they, legalize marijuana, and then we can start going to those fields. Or anything that the director or the administrator declared to be a pest. So essentially that's what a pesticide is. What is special about pesticides? Pesticides, well, they're a class of hazardous chemical that is released into the environment in a controlled fashion to accomplish this function, pesticidal function. They are a class of toxic materials that are intentionally added to the food supply. Hopefully they degraded by the time you get to it. And finally, they are designed with lethality in mind. If the material didn't have some kind of lethal or other kind of effect to an organism to either repel or do whatever it wanted to, no one would make the stuff. I mean, benzene, they use it for feedstock, but it's also lethal too.
What I'd like to do right now is talk about two other programs within our branch where we use outreach and education to meet our goals. The first program I want to talk about, Harvard sort of mentioned it, PISP, Pesticide Illness Surveillance Program. How many of you are aware that California has a pesticide illness surveillance program? Did you know that we're only one of 12 states that actually have a pesticide illness program? But what makes us really unique is that compared to the other states, which may have maybe 5 people doing investigations throughout the state, in California, we happen to have an MOU with CACASA, the California County Ag Commissioners and Sealers Association. So what does that do? Essentially what that does is it assures that we have representation in all 58 counties. And as far as illness investigation is concerned, we are able to investigate anything that any reports of a pesticide illness or injury in any county. And the nice thing about that is, at any given point, we have a snapshot of what's actually happening out there. California happens to be the oldest, happens to be the state that has the oldest, most robust pesticide illness surveillance program. In fact, we were the basis for the surveillance programs of other states. So why am I mentioning this? So I mentioned that, okay, the counties are doing our investigations for us. This is where the training comes in. We have to make sure that the county investigators know what information to collect. So every 2 years, we, the epidemiologists in the pesticide illness surveillance program, we go around from Northern California up there in Redwood down to Imperial County. As we go through these forums, we sort of fine-tune our mitigation strategies, and we use their feedback to come up with the most practical and scientifically sound mitigation strategies possible. It might not please everybody, but we feel that having heard feedback from our stakeholders, we come up with really good strategies. So I guess I want to end the presentation by coming up with an example where this approach has been really effective, and that was with MITC. The mitigation strategies were implemented in 2010, I think, but prior to that, what the mitigation team did was to meet with most everyone who got ill from MITC. They met with them, found out what their concerns were. They did a lot of site visits to find out how the pesticide was being used, how the fumigant was being used. So they came up with a mitigation strategy, and to this day, we've only had one illness, and it was associated with actually an equipment failure, which prevented the grower from practicing or complying with mitigation.